improves nursing practices by ensuring that our practices evolve with the times and that they're always based on the best available scientific evidence. Research also allows us to examine and better understand our healthcare system, our patients' needs, and how we work. In doing so, it prompts us to address and bridge gaps in our care delivery, thus helping us provide safer, more efficient, and effective care. So one misconception is that research is boring. Research is not boring. There are so many things you could do. You could synthesize evidence, break it apart, create your own evidence, share, teach, and help implement changes in practice. There are many disciplines you could look into as well, like wound care, critical care, medicine, and so on. There's something for everyone, and never a dull moment, especially when you're doing your own research study. So research can be fulfilling and interesting. You just need to find your own area of interest. My proudest achievement is the translation of one of our recent research findings into practice. I was part of a team which looked at the treatment of incontinence-associated dermatitis, which is a painful and common skin condition. We did a study and determined that adding a specialized skin cleanser into our current care can improve skin healing for our patients. Tying this with the latest evidence, we implemented a change in practice by incorporating the cleanser into our routine care, created a bundle for IED prevention and management, created a fun poster for nurses to learn from, like this, shared our findings across multiple platforms, and also made up a patient education guide for our caregivers to continue care at home. Being able to share our knowledge and findings, and also effecting better patient care, especially for something as unpleasant as IED, makes research meaningful and therefore remains my proudest achievement to date. Always be curious about the world around you and ask yourself why do this and why not do that, and always strive to do better for your patients, your colleagues, and yourself. A degree may be helpful, but it's not necessary. Here at Tan Tock Seng Hospital, we have a wonderful nursing research unit as well as journals and programs to support and guide you should you choose to embark on this path or need help with any research-related activities. So join us!
Okay, so first and foremost, importantly is you will need to get a placement either in ITE, diploma, or even NUS or SIT. So that is the first step. Secondly, to get more information on how the sponsorship program is, you will need to go to our career portal. They will have the allowances, the GPA that you will need to meet, and the different criteria in our career portal. You can also put in an online application as well as your latest results on our career portal. This is a common question. So many people ask, after if I get sponsored diploma, do I get a chance to further my studies in degree? So yes, the answer is you can further your studies and there is an opportunity for you to do so. So once you complete your diploma, what you have to do is write in to us so that we know that you want to further your studies, and then we will seek approval for you, and you will get approved to get deferred your firstborn so that you can continue your studies in your degree studies, and then after you complete your degree studies, you can serve 2 bonds at one time. Okay, so posting of departments, what we always do is during the onboarding process, after you have completed your studies, we will ask you for your preferences. You can give us up to 3 preferences according to your priority. For example, number 1, you want to go inpatient wards, number 2, operating theatre, and number 3, emergency department. The posting is actually done by nursing service, who will be looking into your preferences, and we will match according to your priorities as well as preferences. In the event, however, if there's no openings in your 3 choices, you will be posted to other departments as well. Specialize in nursing, I would say as a fresh grad, do join the hospital, work a couple of years first. We do have programs like the Advanced Deep, where you can specialize in peri-op or even med-surg, where all these you can specialize in different kinds of discipline. So you will need to clock in a number of years of experiences, and then we will also put in some recommendations through your reporting officer so that you can specialize in your preferred areas. career progression is pretty straightforward. I think a lot of nurses would probably know the career path already. So of course, as diploma, you join as a staff nurse 2. For degree in NUS and SIT, you join as a SN1, which is a staff nurse 1. Followed by, after a couple of years, as well as your performance and merit, you will go up the career ladder, which you will become a senior staff nurse, and then ANC, and then you can choose your track. For example, education, clinical, manager, or research. So we have 4 tracks for you to choose moving forward and after years of experience.
Being a rehab nurse, you need to have compassion and commitment in caring for a patient with disability in rehab center. First of all, you'll be going through a series of training provided by the hospital as well as the department. And in rehab, we have a specific rehab course that is programmed to help you to gain more in-depth knowledge into the rehab management of different disciplines such as the stroke management, spinal cord injury, acquired brain injury, and orthopedic nursing. This will help you to provide a safe care to our patient. The ultimate rehab goal is to help our patients to reintegrate back to the community with their best functional ability that they can achieve during their stay in rehab. So at the same time, the medical care, the nursing team and the allied health team is trying to align their expectation together with us to set the short-term and long-term goal. And this is very important in achieving their goal in the rehab before they go back home. Evidently, COVID-19 has affected everyone, including ourselves, our patients and their family, where the visiting hours are restricted. It has cut off their direct interaction and support from their family. So as healthcare workers and nurses in the ward, we are there to support them and give them moral support in their psychosocial aspect. Well, I would think that the biggest challenges is that the dependent care from the patient and the burden that the family face. So I guess we need to reshape our mentality and how we deliver our value and caregiver training to them. I believe it will strongly help them to support the family, to bring the patient back to the community when they go home. In Rehab, we are a multidisciplinary team that are in charge of different disciplines such as a stroke, spinal cord injury, orthopedics, and acquired brain injury. So we actually face different kind of challenges in nursing this group of patients. Like for instance, for spinal cord injury patients, we are very specific on the bowel care so that they will not develop complications like the autonomic dysreflexia condition that can actually risk their life. And besides that, we also have a group of patients who require ventilator. That in future we have this ventilator rehab unit in ICH, so our nurses need to be trained in this aspect to provide better care to them in their respiratory care.